Vacuum cups are used in the treatment of pneumonia and bronchitis. It is necessary to set only when there is no temperature. Apply the oil to your hand and start with the stroking to get the patient in the mood for the procedure. The patient's body should be covered, except for the area where will be work. If the patient has pneumonia, massage should be started from the healthy side, according to the rule of 8. The jar should slide easily. If it falls off, add a little oil. With bronchitis, bags can be placed permanently. From the most protruding cervical vertebra, C7, cut down to vertebra and at the distance of 1.5 phalanges of the middle finger. Place 3 bangs on one side and the same on the other. You need to keep it for 2 to 5 minutes. For pneumonia, place the can over the scapula, along the spine around the scapula and over the ribs under the scapula. If you put on the scapula, there will not be air, but there will be no impact on the lungs either. The patient should be covered and allowed to lie down for about 20 minutes. During this time, toxins are drawn out from the skin, which is deposited along the edge of the skull. If you keep the jar for longer than the specific time, you can be burned. Rubbing can be done at the end of the procedure. Run one can first along the spine, then around the intercostal spaces of each other of the back. We finish the procedure by rubbing. We make smooth and slow movement, patting on the back that evenly distributed by circulation. Be sure to give the patient a glass of water and rest for 20 minutes. After the procedure, the jar must be washed with soap and warm water.